It's an incredible U-turn that we are expecting is going to be announced today. It's not 100% confirmed, but certainly the papers reporting it seem very, very clear that is what's going to happen. Why do you, first of all, your reaction to the news that it is going to be overturned, and why do you think it has been overturned?
Well, I mean, ecstatic about the news, and particularly that at least the Telegraph's initial report is that it's going to include care home workers as well. That's a recognition that the mandate is wrong and was wrong. So it was wrong to apply it for the care home staff when Delta was predominant, and it's still wrong to apply it, even more wrong to apply it now with Omicron. I think the evidence against the government, I've been sort of working on a three-pronged attack. One is the practical side. They've never won the argument to say it's a good thing for the NHS practically.
Yeah.
They've never won the moral argument. They know that the staff are against it from the beginning and the public have been against it as well. And the scientific argument has got weaker and weaker.
Yeah. Especially with the evidence. I mean, early on when we first had the jab with the previous variants, it did appear, the early evidence, again, it didn't bear it out, and it certainly hasn't borne it out with more recent variants, that you could have a much higher chance of not transmitting to other people. And therefore, I felt at the time that made it pretty sensible to get the jab in terms of not being able to put other people at risk. But that was also the case with people who already had COVID. And like you, I had the antibodies, I already had COVID.
Yeah, and for you, as we've discussed before, it was a choice. You weighed up what you felt was right, and you made a choice. No one forced you to have it or said you can't talk radio anymore. And that's very, very important.
Yeah.
Mandate.
The slippery slope aspect of this, I think, has concerned a lot of people. As you say, these reports saying this would affect the care home workers as well. So presumably that would affect care home workers who might be newly employed. But the reality is thousands of care workers either were sacked in the autumn last year, or actually just left of their own accord for other jobs because they knew they would be sacked, who hadn't got the jab, even though they were those, on the front line without often PPE, tending to our loved ones when we weren't legally allowed in to care for them in care homes. Should they reinstate all of those care workers who lost their jobs?
They absolutely need to reinstate all those care home workers. And there also needs to be work done now to look at the harm caused by this policy.
Yeah.
People who were unfairly dismissed, people who were coerced, and people who've suffered psychological issues as a result of it.
Yeah. But in terms of the motivations for this, why this has happened, is it because they realise, I think Sajid Javid is a very bright, very sensible guy. I worried he went a little bit native, as anyone who goes in the health department does, in terms of believing an awful lot of, frankly, the SAGE. I mean, what proven to be nonsense, not my opinion, it's just proven to be nonsense, all of their modelling. But the idea that, have they come to their senses and gone, okay, this was a bad policy, morally, scientifically, it's not proven, we should stop this policy, it'll cause more harm to patients than by not doing it? Or have they been pushed into this by the fact that the NHS would be in absolute crisis? You'd have far more treatments cancelled and operations delayed. You'll have the staff up in arms, and backbench rebel MPs furious about this and wanting this overturned. Has the government been dragged kicking and screaming to this position, or have they made a positive decision to overturn a policy that they now know to be wrong?
Well, I don't claim to be a mind reader, and we'll always be guessing at what their true motivations are.
What do you think, though?
I think they've seen they can't get away with this, and the public wants an open debate. They want the information available about vaccine efficacy and side effects in different age groups and with different risk factors. And we've got to move away from this. Vaccinate the entire population is the best thing.
And that's the interesting thing, isn't it? When we first were told, they'd got this vaccine, they were going to roll it out. Kate Bingham, who was head of the vaccine task force, she was very, very clear. There were interviews after interviews. They were not going to vaccinate the whole population. They were going to vaccinate those who were at higher risk. And even recently we saw, someone over 50, their chance of being hospitalised or dying of COVID was reduced, to just 95% reduction by having the COVID vaccine. You have a much smaller risk of going to hospital. Well, hold on a minute. Only 1% of people who get COVID go to hospital anyway. And only a tiny fraction of those, even in their 80s and 90s, who get COVID die of or even with COVID. So we've never in the mainstream media, we've certainly tried to do this at Talk Radio, had this nuanced conversation that this is not just, I love Lawrence Fox, he's a good friend, but when he says this is just a slightly bad cold, it's not a slightly bad cold for people who are elderly and vulnerable. It's a very serious disease. We've never minimised it at all here. I've had a rotten cough for 4 weeks having had Omicron, and that's the mild version. However, it is much milder and much less of a risk for people who are younger and healthier. And yet the government and so many people involved in this have been so unwilling to discuss that nuance, which is children are barely at risk, young people are very at small risk. Really, unless you are very overweight or have a lot of vulnerabilities, if you're under 60, you're at very low risk. Why do you think people have been unable to take on this really quite simple concept?
Because the message began, it's only for vulnerable adults. It's now for some adults. It's now for all adults. It's now for some children. It's now for all children. It's this incremental approach that has given everyone the feeling that they're only safe if you continue on to the next dose of vaccination.
But why are they doing that? They're now talking about rolling out the jab to vulnerable children as young as 5 years old. Properly insane. There's going to be no medical evidence about this, but other countries did it. They rolled it out to 12-year-olds and they rolled it out to 5-year-olds, and so we're going to do it as well. We know there's no evidence for this. We certainly know with Omicron, there's no good evidence for this. And the risk ratio for children gets worse and worse. And the risk ratio any over 50 is a no-brainer. Have the jab. I'm sorry, have the jab. But again, it should be a free choice. But for children, we know the risk ratio is the other way around. So why would they do this? Why is there so much pressure? Is this sort of the public having been scared out of their wits with some, frankly, quite false information about COVID, demanding it and wanting it? Because I don't know any parent who wants their kids jabbed.
I think it's a monocular view about how to benefit society that a single drug or vaccine can bring about. It's a silver bullet, and simply more of it will be better.
Yes, and you had all your freedoms taken away. We had a terrible time, but if everyone's jabbed, suddenly everything comes back. Now, we've had that message for a year or so, and we're constantly under threat of another lockdown.
And the public knows it just doesn't make sense anymore.
Yeah. Well, I have to say, I know my listeners would want me to thank you for the role that you have played. I think so many people were willing to buy into the idea that anyone not having the jab was a conspiracy theorist, was a lunatic who didn't know, ignorant. That nobody, including the Health Secretary, Sajid Javid, when confronted by you in such a measured, respectful and fact-based way, could play along with that narrative that it was, here was an ignorant conspiracy theorist being anti-mandatory jabs, not jabs, mandatory jabs. And you speaking up, I think really, really turned the argument over. And I have to congratulate you and thank you for that.
Well, Julia, I want to thank Talk Radio because you've given a lot of airtime to people who wanted to speak out, to the Together Declaration, to NHS 100K, Workers of England, Jackson Osborne, who brought the legal case, all the members of public and the other professionals who stood up against this. It's been an enormous collective effort to bring this about, and it's a real sign of the power people have when they feel things aren't right.
And when they speak out, indeed. Well, we keep on fighting for sanity to come back. Dr. Steve James, you are a hero, I think, to an awful lot of people. And we were clapping for you 2 years ago. Thank you very much indeed for joining us.